The Inflation Reduction Act marks the biggest federal investment to fight climate change in U.S. history. That's been one of the major talkers. But it also marks a major change in U.S. health policy, specifically in regards to Medicare. President Joe Biden signed the bill into law just earlier this week. This morning, the Senior Vice President of Government Affairs for AARP is here to talk about some of the changes within Medicare, how this is going to affect seniors. Bill Sweeney, good morning. Thanks for your time. We appreciate it. So, top of mind, the big things in regards to Medicare: insulin prices, prescription drug costs with the annual caps, and then drug price negotiation. Big three. So let's start with insulin prices for seniors. How much have they been paying? And then how does this change going forward?
Well, there are about 3.3 million seniors in this country who take insulin to control their diabetes, and the prices have been all over the map. Some people are paying $35 a month, some people are paying $100 a month, sometimes people are paying more. And so under this bill that just passed, that just became law this week, no one will pay more than $35 a month for their insulin who's on Medicare.
Obviously, many people on Medicare have fixed incomes, so that is budget friendly. Also, with caps on annual prices out of pocket, capping at $2,000 a year in a few years. How will this change what these seniors are paying now?
Well, I think this is going to be one of the biggest changes in the bill that's going to impact people and bring down their costs. You know, there's about a million people in Indiana who have Medicare prescription drug plans. And under this law, when this cap comes into effect, they won't pay more than $2,000 a year. Now, what that means is that you get peace of mind that if you get a diagnosis from a doctor of cancer where the drugs could cost $10,000 or $15,000 a year, you won't have to go bankrupt to get the treatment you need.
Finally, something that the pharmaceutical companies have not wanted to see is for the first time Medicare can negotiate prices of these prescription drugs. How does this impact the bottom line for seniors?
Well, this is huge. This has been decades in the making. We have been fighting so hard for this and been stopped really every step of the way. This is going to be a tremendous change, finally letting Medicare negotiate, using its buying power on behalf of the 50 million people who have Medicare, to use its buying power to negotiate for lower prices, just like Sam's Club or Costco could do. It makes no sense that for years we've made the federal government just pay whatever price the drug companies charge for these medicines. So finally we'll be able to negotiate and start seeing some of those prices come down.
The federal government, the Biden administration has said they are working now on the rollout plans, how this is going to be implemented. So seniors with questions about the timing of all of this, can you give them a quick rundown of what you know and what they can expect today and in the years to come?
Absolutely. So there's also a new policy that says that if drug companies charge more than, or raise their prices more than the rate of inflation, they're going to have to pay the difference back to the government. That goes into effect right away, as do, starting in January next year, free vaccines under Medicare. So if you need a recommended vaccine like the shingles vaccine, which can cost $300 a shot, those will be free starting next year. And then finally, the negotiation process is going to start at the end of next year, around the first set of drugs that will be covered by the bill, and that will take a few years to go into effect. But we'll start to see that back and forth negotiation with the federal government starting at the end of next year.
Bill Sweeney, Vice President of Government Affairs for the AARP. We really appreciate your time this morning, breaking it down in an easy way to understand. Have a great day. Thank you.
Thank you, Kylie.